Breast cancer. Two words that can bring fear to millions worldwide. It is one of the most common cancers affecting women. But do you know that men can also develop breast cancers? Yes, every year millions are diagnosed, but thanks to scientific research, awareness, and medical advancement, survival rates are improving. In today's episode of BioScope, we will uncover what breast cancer really is, how it develops inside the body, the genetic and environmental factors involved, and the latest treatment scientists are exploring. At its core, breast cancer is simply uncontrolled cell growth in breast tissue. Normally, our cells follow an orderly cycle of growth, division, and death. But when mutations accumulate in critical genes, this cycle disrupts. The result? Cell divided uncontrollably, forming a lump or tumor. If this tumor is malignant, cancer cells can invade surrounding tissues or travel through blood and lymph to distant organs, a process called metastasis. Now, the breast cancer doesn't have a single cause. It's a mix of genetic, hormonal, and lifestyle factors. The first one is the genetic risk. Mutation in BRCA1 and BRCA2 genes dramatically increases the risk. Second is hormonal influence. Estrogen exposure plays a role. Early menstruation, late menopause, or hormonal replacement therapy can increase the risk. Third factor can be the lifestyle. Obesity, alcohol consumption, smoking, and lack of physical activity. Fourth one can be the family history and age. Risk increases with age, and if close relative had breast cancer, then you might be one of the target. Now let's discuss about the types of breast cancer. Not all breast cancers are the same. Doctor classify them into different types. The first one is ductal carcinoma in situ or DCIS. Here the cancer cells inside breast duct but not spread. The second one is invasive ductal carcinoma or IDC, most common, spreads beyond ducts. Third one is invasive lobular carcinoma ILC, begins in milk producing lobules. Next one is triple negative breast cancer. Here lacks estrogen, progesterone and HER2 receptors, harder to treat. And the last one is HER2 positive breast cancer, driven by excess HER2 protein but treatable with targeted drugs. Early detection can save the lives. Common warning signs include lumps in the breast or underarm, changes in breast size or shape, skin dimpling or redness, nipple discharge or invasion. This is why self exam, clinical breast exam, and mammograms are so crucial. The earlier it's found, the better the treatment outcomes. At the molecular level, breast cancer often begins with mutation in tumor suppressor genes like p53 or in DNA repair genes like BRCA1 or 2. Without p53, cells with damaged DNA keep dividing. BRCA mutation prevent repair of broken DNA. Growth signals like HER2 overactivation drive rapid cell division. Cancer cells also learn to evade the immune system, recruit blood vessels for nutrients or the angiogenesis, and invade into other tissues. Doctors use a variety of tools to diagnose and classify breast cancer. The first one is imaging. Here, mammography, ultrasound, MRI can be done. Second one is biopsy, removing tissue to examine under microscope. And the third one is staging, based on tumor size, lymph nodes, and metastasis. The process is called the TNM. Stage 1 means localized, where stage 4 means cancer has spread to distant organ. Here you can see the TMN system of staging breast cancer. The T means the tumor size, the N means the lymph node status, and M means the metastasis. Based on this, we can categorize the stage of cancer. Treatment has evolved enormously over the years. Options depend on cancer type, stage, and patient's health. The traditional therapies include surgery, that is, lumpectomy or mastectomy, then radiation therapy, killing cancer cell with targeted beams, and chemotherapy, drugs that attack rapidly dividing cells. Modern targeted therapies include hormone therapy, drugs like tamoxifen block estrogen, HER2 targeted therapy, trastuzumab or Herceptin blocks HER2 receptors, immunotherapy activities the immune system against cancer, and mRNA based therapies and CRISPR research, which include the new frontiers in personalized medicine. While we can't prevent all breast cancers, risk can be reduced by maintaining healthy weight and active lifestyle, limiting alcohol, quitting smoking, regular screening especially for women over 40, genetic testing if family history is strong, and most importantly, spreading awareness and supporting research. Breast cancer is not just a medical condition, it's a human story that touches millions of lives. Thanks to modern science, early detection, and advanced treatments, survival rates are rising and hope is stronger than ever. So, whether you are a researcher, a student, or someone seeking awareness, remember knowledge saves lives. This is BioScope, uncovering the biology behind life and disease. Don't forget to like, share, and subscribe for more. Thank you for watching.